to the Morning Blend with our continuing series Insurance 101 with Sovereign Select. Well, you've heard this before. Medicare's annual enrollment began last month and it runs through December 7th. Likely you've been inundated with mail, commercials, and phone calls. Well, today, independent Medicare broker Julie Lucy is here. She's going to help you eliminate the confusion and make sure you're on the right plan for your own healthcare needs. How are you, Julie?
Good. How are you, Tiffany?
I'm doing great. I think that's a big thing, right? People getting so much of this information. We know it started back in October. It's going till December 7th. This is something that you can do, is really do a consultation with people to help eliminate that confusion.
Yeah, we do it all the time. We do no-cost consultations for people turning 65, for people who want to change during the annual enrollment plan, for people that are getting off their employer plan and going on a group health plan. The reason this is so important is that we want to ensure that people are on the right plan for their medical needs as well as their financial needs. At Sovereign Select, we're all independent agents, meaning that we represent dozens of different plans. We don't represent any companies. We work for the client, so we're completely unbiased as far as the selection that you make, whether it be an Advantage plan or a supplement. We can do the no-cost consultations online, in person, or on the phone. Anyway, however people are comfortable with COVID today, we can do a no-cost consultation that way. We also can help people during the annual enrollment period save money. This is a big one. And one of the biggest ways that we can save people money during the annual enrollment period is by changing them from a Medicare supplement to a Medicare Advantage plan. Medicare supplements were very popular 15, 20 years ago. But when Medicare Advantage plans came around, they provided extra benefits. So the problem with being on a supplement is that your premiums can go up as much as 10% per year. So in some cases, 20%. So by the time you're in your 80s, you may be paying $350 for your Medicare supplement, in addition to paying the premium for your part or your prescription drug plan. So they get very expensive as you age. More and more people are shifting towards the Medicare Advantage plan, much lower premiums, and they offer a lot of extras like dental, fitness, vision, hearing, and over-the-counter benefit.
Absolutely. I think all those things are going to sound good to people. And I've been hearing a lot about the insulin savings program. Can you explain some of that for people?
Yeah, I think this is the biggest and best change for this or next year's Medicare population. So what is happening is it's almost like the government's first attempt at lowering drug prices for seniors. So people that are on insulin, and that's about 10% of the population, can choose a Medicare plan in which they will only pay $35 per month for insulin. So that saves people at least $400. And if you're on insulin during what we call the donut hole, it could save you $1,000 or more. So not all plans have this insulin savings plan. So if you're interested in it, give me a call. We can just discuss plans that do cover the insulin at $35 a month. And if you're not on the right plan, it's the annual enrollment period, so you can change your plan to get the insulin savings if necessary.
I think saving money sounds so good to people. And Julie, I know that you get a ton of calls from people that you work with to help them save money on their Medicare. And that means a lot to so many people. So are there other things that you recommend people who are turning 65 to consider?
Yeah, there's a number of things. The first is if you're on a employer group health plan and you're 65 and still working, you want to evaluate the cost of your employer plan versus that of Medicare. Medicare 80% of the time is less expensive than a group health plan. And we can do a comparison for you. The other item is, unfortunately, with COVID, a lot of people have been downsized. And when people are downsized, they usually are offered Cobra as their insurance. But the thing about Cobra is it's very, very expensive. So if you're 65 and older and you've been placed on a Cobra plan, please call me. And we can do a comparison to see how much, to see what's going to be your best choice, a Medicare plan or a Cobra. But I'd say 99% of the time it's going to be Medicare. And last but not least, arm yourself with education. We do the Road to Medicare classes. I'm doing them 2 or 3 times a month right now. And this is so important that you understand Medicare and what kind of plan you're on. So, you're going to find out when to sign up for Medicare to avoid late penalties. What are the A, B, C's, and D's of Medicare? Should I be on a supplement? Should I be on Advantage? What's best for me?
All right, again, make sure that you arm yourself with education by attending one of Julie's free Road to Medicare meetings. They can be done virtually or one-on-one over the phone. They're happening Monday, November 23rd and Tuesday, December 1st. Both are at 10 a.m. There's no specific insurance company plans that will be discussed. So here's how you contact Julie Lucy. Give her a call directly at 414-253-3554 or email her at julie@jlmedicare.com. You can also go to her website, which is jrmedicare.com as well.